go for you?
It went very well. So I went in there knowing I was gonna pass, and when I got my
Good,
score, it said pass, so I already knew. Your
good.
course prepares us very well. So Dr. Lopez, what I did on the exam, so I tallied up all the questions. It was 123 questions on the exam that was from your course.
Oh my.
And yeah, and that is equal to 70% of the exam. And I had 42 questions flagged, and even if I got all of those wrong, I still would have passed.
You still would have, and that doesn't count
Oh yeah, that's right.
associated knowledge, right?
Mhm.
Because the associated knowledge, you'd be like, I got it, I understand why, but I don't know how it came to my head, but I got it, right?
Exactly.
So that is absolutely awesome. Just by the math alone, I can almost
Mhm.
guarantee you that you probably.
70%.
No, 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 no. I guarantee you probably statistically, you probably got 90, 88%
Oh,
of the questions, because even if it's not like straightforward, you can think like, oh, I heard this somewhere. I kind of know
mhm.
where it's going. I can figure out the answers,
Exactly.
right? It's not like that you're going at it at 0% and you have a 25% of picking any of the four choices and picking right. So you knew the content. So I'm super stoked. Tag us,
Yeah.
send me an email for sure, and let's cross you off the book and then give you a gift. I
Thank
really,
you.
really
I will
appreciate it.
email you. At the end of today's lecture, I just want to go over some questions that I thought
Yeah,
were hard. So
yeah. So
I'll stay behind.
thank you so much, Tag. That's very awesome of you for helping the community and clarifying questions to the students and giving, those folks that are really kind of stay back. We have people in our communities for 5 years ago, and they still helping students. I absolutely love that. So thank you, Tag. Appreciate. So
Of course.
stay with us. All right, Chi or Chai.
Oh yes,
Wow.
Dr. Lopez. I am so happy. I just passed
Well,
right now.
just right now, oh my
Yes,
God,
yes,
7
doctor,
p.m. You
right
just
now.
passed.
I'm just on my way home. Oh my God. Man, you all trust the process. Know the content, the crash course review, the diagnostic test, they're all just there. They only
All
twist
right.
the words. They twist the words, but because you
Yeah.
know the content, you will grab the answer so quick.
Awesome. All right.
Trust the process.
All
Yes,
right.
doctor.
Awesome. Amazing. So please send it. I mean, I'm telling everyone, please send me an email so we can update our stats and stay true to what's really happening. I really appreciate it. Been working a lot, building this new course with lots of image, lots of charts. My finger hurts of typing. So thank you. I really, really appreciate coming in and giving us the feedback. All right.
Mhm.
Amazing. All right. Chevelle Williams.
Hi, Dr. Lopez. Good
Hi.
evening. Hi,
Hi. Good
everyone.
evening.
I just wanted to touch base with everyone. I passed yesterday
Amazing.
with my
Wow.
boards. Thank you so much. I want to thank you for everything, your guidance. Guys, listen to him. He knows exactly what he's saying. Follow his guide.
Wow.
Um, my exam, I said it in the group yesterday. It wasn't as easy as I thought.
It's never going to
I
be
got a
easy,
lot of
right?
bizarre
Yeah.
questions, but yes. But
Awesome.
I fought. Because
That's
in
it.
the middle
Fight
of
for every
it,
question. Yep.
absolutely. I kept hearing your voice. I remember when you said fight, I had a bad anxiety when I got in there, but I stuck it
Mm.
through. I stuck it through. I saw a lot of your content from
Good.
the first crash course review, the new one that you did
Uh-huh, the
as
mini crash
well.
course review. So everyone, by the way, so I don't want to cut you off, but I uploaded a PowerPoint yesterday uh, on your modules for the mini crash course review. Okay, so these are what I think maybe the most 100 questions that's most useful. I mean, we have a lot of questions, over 2,000 questions altogether, right? But it may, the content, I think will be super helpful. So if you are testing soon, so you have it. I created that recently and uploaded as of yesterday. Chevelle, if I'm butchering your name, my
Yes, sir.
apologies. But please send me an email so that we can update our trackers and give you a gift. Thank you for passing. I think you're gonna love this gift. Okay.
Yes, I did email you
Okay.
yesterday.
Okay. Yeah, I
Yes, sir. Thank
probably
you
haven't been
again.
able to get through my emails, but I will surely respond. Nice. Thank
Yes,
you.
sir. Thank you so much, and all the best, everyone. Claim that green tick. You got it.
Amen. All right, Nicole. Hi.
Hello, how are you?
Good. And yourself?
I'm great. I just wanted to say thank you so much. I passed the boards on Friday.
Amen.
And
All right.
yeah, there was a
Excited.
lot of the questions. The content on there was, I find, very familiar from the course. And what I didn't know, exactly what you said, know your content, because you can kind of work it
Get
out
out.
if
Yeah.
you know, you can figure it out. Yeah. So thank you so much.
Excited. So now on to bigger and better things, right? So now
Yeah.
it's when the life really is going to start, and as a
Mhm.
PMHNP, and you are going to feel this. Oh my God, I love this. So that is awesome.
Yeah. Well, I'm going to sign up
Amazing.
for your pharmacology course as well. So
Yes, it's going to be harder, okay? But it's
Mhm.
going to be, I mean, that's where your next step is, right? So it's no longer about
Yeah.
passing the board. Now it's
Mhm.
really mastering the medication, because that's what it's good to know therapies, but
Mhm.
that's not what we do mainly or every day, at least, right? Well,
Yeah.
congrats, Nicole.
Thank you
Appreciate
so
it.
much, and good
All
luck, everybody. Thank
all
you.
right, take care. AJ, folks, so we have a little bit of time, so if you don't mind, let me just talk to those folks here real quick. And then, because we only have 5 modules today. So AJ, Lung,
Hi, Dr. Lopez. This is AJ.
hey,
Hi. I want to add to this saying I'm going to tell everybody that I took the board twice and didn't pass. So
what?
yes, but I'm going to suck it up, and I'm glad that I'm on this class and signed up for this class, because it is true. I have seen many of the same questions that are coming across in the content, that it's right in this content. So I'm very appreciative of the class and how you're presenting it and the different ways of thinking through the different questions. So I do want to say to everybody, if you are stressed out, just know what Dr. Lopez is teaching, because he knows what he's doing, and you're going to see the same contents and some of the same questions on your board.
All right, so
That's all I
I'll be
wanted.
waiting. Yep,
Yeah.
Staying positive is the main important step for success, right?
Yep.
All right, thank
Thank
you.
you.
Jose, Bella B.
Yes, Dr. Lopez.
Hi,
Rose.
Rose. I'm sorry. Yes, Rose. I
Flower.
called you Jose. Sorry. Hi, Rose.
Yes, a question. I remember that the crash course, you said that you were going to upload
I already
the
did.
video.
The new videos, so thank you. The new videos have been uploaded yesterday. The new 100 questions have been uploaded yesterday. Okay,
Where do we see the new video?
they are uploaded.
No, where? Or which section?
Module 6 of your course.
Okay, thank you.
Okay, all right. Kim, I'll come back to you. I know you have probably a personal question, because I just saw your email popping in, and then I'll address that because we were about to get started. Okay, let me just see if those two folks, Shanavia, or is
Yes,
it
Dr. Lopez, I test on Thursday.
okay?
I am nervous,
No,
but
don't be. So stay put. At the end of today's event, we'll go ahead and address those questions specifically. Okay.
Okay, and you said the new 100 questions is under module 6, label new crash course content. I said through I've said through your crash course twice.
I'll go ahead and go over with everyone. We'll kind of, show you exactly where it's at. Okay.
Okay.
All right. Thank you. Same thing. Swiva. If it's, yes.
Yes,
Hi.
I want to say thank you. I took my exams on Sunday, and God has so merciful. I did pass. I wanted to tell everybody when I started this, when I say I did not know anything, I was confused. A friend of mine took hers with you, and she said, "You can try." And I said, "But I have 4 little ones. I don't know how I'm gonna do it." But my friend said, "Just go."
Oh,
But I attend your Tuesday, Wednesday class, and basically that's, and then I followed I did all my crash, everything you asked except the supplemental. And then when I was taking the exams, I was just counting the ones I'm getting. It was only 20 questions that I did not have any idea. The rest of them, literally I was writing the ones that I did not know. It was only 20 questions out of the
all right.
175. The rest I was like, oh my God, have I not seen these questions before? The answers were right there. It's like when I did not get a time to do all your PDF, but the last crash course that you did, that I attended, the PDF that you posted, the new one, that's the only one I went through.
Oh
But
my.
aside that, I did everything. And the first time when I attended you, the first time I signed up on June 9th, when I attended your June crash course, I was so overwhelmed. I did not even follow through. I was like, no, I don't think I can do this. By little, I find my way. And then I was able to, I never made it to the Kahoot or anything, just only following the process. And Dr. Lopez, I really appreciate what you do. May God bless you. Like you have no idea. This was
Thank
just like a
you.
godsend. And Sunday, I was like, oh my God. I was sitting in the exams when I was done within like less than 2 hours. And I
All
had all this
right.
time on my hands. So let me go pee. And I came back. I'm like, what else do I need to do? And I was just literally marking myself in the exams. I was just marking my work. And I said, oh, 20
Okay.
questions, it's okay. So God bless you. I
Right.
just wanted to jump in right quick and say thank
All
you.
right. Thank you so much. Folks, I do apologize. I know you guys want to get started with the class, but like I'm telling you, we only have 9 modules between today and tomorrow, so we do have a little bit of time. If neither of Nirvana or Harrieta or any of you guys pass, no?
Yes, Dr. Lopez. I just want to thank you
All
and
right.
thank you, your crew, including your
Yes.
wife, including you, because she's very, very prompt. When you send email, she just answer. I am
Yes.
very, very grateful. I did my exam on Friday and I passed. And
Amen.
to surprise, I had an hour and 45 minutes left to go back and review.
Oh
And
my, that's you really worked it.
yes, crash
You knew
course,
it.
everything you said, I followed, and it did work out well. So I am very, very grateful and thankful. And I hope that what you did for me, I will have an opportunity to do it for someone else. Thank
Amen.
you.
And that's
Thank
what it's
you.
all
God
about.
bless you
Pass it
and your
over,
family. Thank you.
Congrats.
Thank you.
Harrieta, are you there? All right, Annie.
Hi, Dr. Lopez. How are you?
Good. Hi.
I'm actually testing next Thursday.
Okay.
I'm claiming a pass in advance, but this week
Yes.
I'm doing the readiness exam.
Okay.
My friend told me about it, so I'm taking it at the testing center to ease my anxiety because I'm one of those ones.
We'll talk about that in a second at the
Okay.
end of today's event, okay? But
Okay.
everyone else, at today's end of the event, I will go over the crash course review. I will show you where the documents are located. There are more documents than videos, right? Because I have one that says neurotransmitters and medications. Obviously, I don't have a video for that because that's covered throughout the course. I have another one that says highlighted or must complete highlighted crash course review. Is another version of it that I highlighted personally what I think is most important because there's a lot of content to go over, okay? But first, I want to thank everyone for your kindness, for your hard work. And it's not the content. It is really is the work that you put into it. The content is it's help. I can't say it doesn't, right? Because we really try to not waste time and really focus on what matters. Because if we try to cover every single thing, then we are going to have thousands of books like I have in my my on my desks. Not thousands, but at least way over 100 books. And that is not helpful. Just say, hey, here's 3 years of a psychiatry in depth, right? But what we try to do is really try to, I ask myself, because I do write questions for a lot of schools, you might have been answering my questions as a student somewhere, one of your universities. I won't say where because, it's not cool if I do. But then I ask myself, what would I ask you if I was writing the board questions so I can get pretty close. I think, because think about this, there's only 175 questions. 25 of them are invalid questions or dummy questions or, testing the next types of questions. And if I'm going to waste one question on the test, not a waste, right? I have to have a purpose. And the purpose is, why is it so important in psychiatry to know this, right? What are the implications of not knowing that? And sometimes it can be weird stuff like, science-based things, which is not a lot of consequence. But when it comes to medications, what are the important things you got to know about medications? If you want to know what's on the board, it's very simple. One, well, it's not very simple because you have to read a lot. Look at the ANA statements. What do they believe in? Which is a lot of what we are going to cover today. Statements, ethics. I have all kinds of books on ethics and ANA and all this, publications that they send out. So if I can figure out what they believe in, I can almost for sure tell you what I think is going to be on the board. Another way of knowing is medications. Look at what are the FDA warnings. That is important. And not only because of an FDA warning. So here is what the magic. FDA warning, hopefully everyone's listening to this. It does not mean to stop your medication. An FDA warning does not mean to stop a medication. So what does it mean? Go back to the research and do your review to find out the pros and cons of using the medication. Do not stop a medication because there is a FDA warning. Now, if you give an SSRI, antidepressant medication to someone that is younger than 23 years old and they develop increasing suicidalities, that is something serious, right? So in that case, your action might be to stop the medication, because increasing suicidality along with someone that's very depressed, that's not a good combination. That can be deadly in many ways. Okay. All right. So today we are going to cover what I think is a very important module, which is Domain 5. And not only it is the hardest module if you do not take a course prep, right? Because we are not really taught on how to respond to cultural questions. We are not really taught on studying laws of psychiatries. We are not really taught about anti-kickback, Stark law. We learn this in the course. The good news is it is the easiest module once you go through the course, because we'll drill, and then we come to the task, we're like, oh, this is pretty simple. But nurse practitioners in general right, that have been practicing for 10, 15 years, they have a hard time on domain 5 because they think critically. In domain 5, it is not about thinking critically all the time, I would say. You know, yes, we still have to think critically. Research is important, but research without analyzing where the person comes from, without taking culture in consideration, means very little. Okay? So this is where we are going to start today, with ethics, legal principles, and cultural care. So Savannah and everyone else, I know that we have a lot of folks that have questions. So at the end of today, I will stay put. If you pass the board, please kindly send me an email. I'm going through a lot of names and our students. I want to make sure our books are up to date. So when we say, hey, we're at 97% passing rate, when we say 98, 99, because it fluctuates, right? Depending how many folks take the board and so forth. We have a very high passing rate. I want to be absolutely true to what we say where we are currently. But as you see today, in less than few minutes, we had tons of people passing the board, tons of people emailed us. So I couldn't be happier with the work that you are doing. You know, it's a lot of work, right? But together we are really moving mountains and making it be a good experience for everyone else. Okay, so if you do have a question, my apologies if you pass the board. I know we have some folks here that have the hand raised, but I need to get started. But let's get started with this, because otherwise we'll kind of be here for a little while. Okay, so my apologies again for taking a little bit longer today. And this is pretty much what we are going to cover in module 5, right? Lots of ethics, lots of scope of practice, lots of standard of practice, confidentiality, principles in psychiatry, informed consent. While a lot of this seems to be kind of simplistic, there is always a hidden message behind it. And that's what we are going to decode today and tomorrow and Thursday. Thursday we have Kahoot. That's when we put in practice. And your goal, it's always, once you finish a module, you have to do the question bank. If you don't, you are going to miss a lot of these nuances. You think you have it, but when it comes in the gray area, you don't know exactly how to answer. And today we're going to get one of the biggest gray area, the Tarasoff principle, right? I get questions on this, I think, every single day. So I really hope that everybody kind of listens to the content and then ask your question today. So that way we can clarify, we can, you know, we can address any of the questions and so forth and so on. What we are going to do, I muted everyone for now, so that way we can have a good sound, and I will stay back. And if you have questions, just put your hands up, and then we'll go ahead and unmute at the end of the class, and then we answer all the questions at once, okay? So again, we will answer first content questions, and then we can talk about just specific cases when you are testing, what should you do or what you should focus. No problem. We'll address all of that at the end of today's event, okay? It won't take very long today. Because it's not a whole lot to cover. All right, first thing we have to understand is the scope of practice. From now and on and ever for the rest of your life. No, not really. Well, maybe. When you think of a scope equals state. Scope equals the state. Well, what do you mean by that? Who determines what you can and cannot do is your state, right? along with the boarding of nursing and the state legislature, right? And determines what you can and cannot do. Florida is different than Texas, then it's different than New York, right? So where we have so many folks that pass here in the chat box too, where the first question that I have for you, if you're looking for your scope of practice and you don't see the State Board of Nursing, where is the scope of practice written at? What is the name of the document? NPA, Nurse Practice Act. The Nursing Practice Act. That defines the actions and procedures and processes that are permitted for the licensed individual. Now let's take a read on this statement here, because this is going to answer a very difficult question, which is related to scope, but it does not make sense. So the scope of practice is the term used by the national and the state licensing board, let's put a parenthesis here, the nursing, for various professions that defines the procedures, actions, processes that are permitted for the licensed individual. Procedures, actions, and process. Now comes the super hard question, and one, I would say that's the most silliest, I'm not going to say dumb, answer that could possibly be on your board. If you have a patient that threats somebody else, obviously we're talking about the Tarasoff principle, right? You have two actions. One, it's called the police. Easy. That is applicable in every state. It's not defined by state A or B. Option two, get in touch with the State Board of Nurses. But why? Well, look at the definition, the why, because it defines the procedures and actions and process that you are allowed to do within the state. Let's walk it back. The Tarasoff principle, it is not applicable in every state. And you are taking a state board, a national board exam. So guess what? The answer has to be applicable for all 50 states. No, I do not like the answer. And no, I actually hated the answer, but it makes sense. If it makes sense, why calling the State Board of Nursing? Give me a thumbs up. Because by calling them, by reading the procedure, you get to know what is allowed within your state. We're not taking a State Board of California. And I do not agree it is a good answer. I do not think it's a good answer. I think it's the most silliest answer. But let's go way back, maybe 20 years, 30 years, or even more for some of you guys, right? Maybe not 35. When you're taking the NCLEX, what is the assumption that you have? There is enough time, there is 25 hours in a day, you have all the resources, all the money, and all what matter is that question. There is no limitation. So in this sense, we can apply this to the question. Oh, someone's threatening another individual. In reality, you may or may not call your State Board of Nursing, and then, they may or may not pick up the phone. You may or may not have time to read the website. But again, in the same format like NCLEX, Don't worry, we got the time, the resources. There is no other patients waiting on us. It's a perfect world. The only rationale that matters here is that by getting guidance with a state board of nursing, you know what is applicable and what is not applicable in your state. Okay, clear? Or somebody, if you're not clear, we're going to kind of follow up and go back to it. And I don't agree that's a good answer, and I hate that answer. But now we have a statement that kind of clarifies why that is important. Now, remember, the number one action is calling the police. Because if the Tarasoff principle is not applicable in every state, one thing that is applicable in any state is calling the police. Okay? What if the answer says, have them arrested? That is a harsh answer. That is not psychiatry. Sure, it's not. But again, preventing a death or serious injury compared to having someone arrested, which you do not have a power to do that. I don't have a power. The only folks that have the power is the local authorities, the police. If that is the outcome, that is the outcome. Would you rather have someone arrested? I'd rather be arrested than dead, or even do something that I will regret and spend the rest of my life in jail, right? So don't look at possible answer that someone might be getting arrested. Okay? So what you need to look at is calling the board of nursing, lame, ridiculous answer, possible, but we know why behind it, and calling the police. And we'll go back in detail of other possible answers when it comes to the Tarasoff principle, but this is a very difficult answer because it does not make sense at all, right? It's a hard one to be like, ah, man, I don't feel good about it, but at least you know the reason why, okay? So that is the scope. What is the problem with the scope, right? Or let me rephrase it. What is the problem with telehealth? Going over your scope of a practice. That is a very important question to know that connects to the scope of practice. Because if I live in Florida and I am licensed in Florida and I am prescribing in New York, I am crossing the scope of practice. Confidentiality, yes, definitely, HIPAA, right, issues, but one of them is cross borders, right? There are many issues with telehealth. I'm not saying there are bad things. I love telehealth, right? But one of the problems is, hey, so let's put it that way. If someone is your patient, let's make this complicated as possible. Someone is your patient, and obviously we are giving an example for the test. Let's say it's your patient of 20 years. I don't care how long, and they need benzodiazepine. Let's say that is the medication. Hopefully, neither of the cases are true, but let's say that is the case. And they fly to New York and says, hey, Dr. Lopes, I forgot my bottle of, lorazepam. I think I'm going to have a seizure. Can you please prescribe me? No, you can't. What do? If it's an emergency, go to the ER immediately, right? So if someone is needing a medication, but you are out of the scope, do not prescribe. You can't do a favor for someone and lose your license and break the law. You can't. As heartless as it sounds, do not do it. And don't create scenario, what ifs. If you're not allowed, Don't do it. Okay? No matter what. No matter what kind of scenario they throw at you. Remember, telehealth and cases in which a patient begs you. No, you can't do it if you're not, licensed within that state. And there are several variations of the why we have different scopes of practice because of outdated laws, right? But that's not what we need to get in depth here today. So just by one slide, we answer several gray areas that will be important for you later. Okay, so remember, where is the scope written? Obviously by whom? Who determines? The State Board of Nursing, right? Well, not really. It's the state legislature along with the State Board of Nursing, and then the Nursing Practice Act, like NPA, right? What does it do? It describes the roles and action that is assumed you are competent as you pass your PMHNP board certification. Okay? So that's what you're going to do. You're going to pass. And now it's assumed you have those competencies to be held by all nurse practitioners in the function, right? And again, we talked about this, has a broad variation from state to state. Why? Because of limitations, right? In the existing legislature, outdated. And remember, how do you support the scope of practice? How do you display leadership when you advocate for nurse practitioners? Issues through professional involvement. So anytime you have questions on leadership, how do you show leadership? How do you advocate for your scope of practice? Look for an answer that is involving yourself with bigger organization, because no PMHNP or nurse practitioner alone, I don't care who they are, can do anything alone. But now gather 1,000 of you guys in one state. You can make things happen. You can make things happen. So when you join ANA, when you join other organizations, you can make movement. You can make things happen, okay? All right, so now when we talked about if a medical evaluation is out of the scope, how do you judge that? Well, we have to get the interpersonal collaboration. So that is a key word. Anytime you have interpersonal collaboration for the board, you need to look at those answers very carefully. This is powerful because this relies a lot of the answers. Again, you're not made to work alone. You need resources, whether it's the LPN, whether it is the nurse manager, whether it is the doctors or so forth. So every time you collaborate with ED, OB, PEDS, ortho, it is a super high yield answer. It is never to refer blindly. You want to collaborate. You refer when you find yourself too deep doing medical stuff. Never refer to a psychologist, because for most part, I wouldn't say never, I would say 99% of the answers don't refer to a psychologist, because the true definition of PMHNP is you can do psychotherapies. So why would you refer to a psychologist? Why would you refer to a psychiatrist? These are incorrect answers 99% of the time. Now, when you collaborate with the ED, when you collaborate with OB, That is a very good answer, right? So in evaluating if one is out of scope or within this out of scope, right, you want to do a interdisciplinary collaboration. Okay. Now, again, who sets the minimum requirements for what you do? The state and the board of nursing, right? Okay. So I think we kind of got a lot of two little slides here, right? All right. So again, this is just an acronym. Is determined by the state legislature along with the state board of nursing. It defines the scope. The legislation varies between scope. Remember, advocate, because that is questions that come up all the time by joining organizations. Interprofessional or collaboration is important to find out if you are within or out of the scope. And that is about it. On the other hand, when we talked about standard, so if scope is the state, standard is national. Now, the standard is much broader and much more comprehensive. And the standard equals quality. Standard means quality of care and is written by ANA. So ANA is also the one that dictates the codes of ethics. Okay, so why would the ANA describe the standard to judge you? Not the way you're thinking, but it is. Well, what ANA does is write the authoritative statement regarding quality of care, right? So they say this is what the right care, quality of care looks like, right? So the quality of care, right? That should be provided when compared to other PMHNPs. So that is very important. It's always comparing you to someone of the same education. But the why, this is why I said to judge you, in a way to help you remember if you did not meet the quality of care, if you did not meet the standard of care, they are going to judge you to help you remember in court, right? It's a way to judge the nature of care provided, and that is legally described as the standard of care. Did you follow the standard of care or not? What is the standard of care? The protocols, the guidelines. Did you prescribe antipsychotics and you never collected the old glucose? You've been prescribed antipsychotics, this patient gained 50 pounds, you never recommended lifestyle modification or switch it to Abilify, Geodon, or Latura, or many other medications. You did not follow the standard of care. Now the patient had a heart attack and the family is coming back to sue you. So standard is a way to judge you. If you are going to court, they are going to pull up the standard. Standard is written by ANA. Okay? It's a legal document that describes what right looks like, right? The law requires the PMHNP to carry out care per reasonable, prudent criteria that other nurses would do in a similar circumstance. Remember, always comparing apples to apples, PMHNPs against PMHNPs in regards to the quality, right? Thus providing high quality care consistent with the established standard, which is written by ANA. Okay, ANA also writes or dictates what ethics or the code of ethics looks like for us, right? So what if you're looking for an answer that says ANA in regards to codes of ethics, but you don't see one? Well, look at the other organizations that fall under ANA. In this case, the American Psychiatric Nursing Association, right? Because you're going to follow the same ethics principles dictated by ANA. Okay, so now we understand fully what is the scope, why when it pertains to the Tarasoff principle, calling the State Board of Nursing is a ridiculous answer, but it is possible, could possibly be, depending how the question is formatted, be the right answer. We understand the standard of care, ANA, leadership, and cross borders in regards to telehealth, right? To determine by ANA why to judge you. And they are going to judge you against the protocols, the law, if you are taken to court, which will not happen. And they are going to look to see if you are consistent with high quality of care, right? If we say, okay, what is the standard of practice then, right? Well, we are going to do our assessment. And for us, in terms of assessment, it is different than an assessment for a RN, right? Assessment for us is collection of data. So now let's go back to what I said earlier. When we have a medication that has a FDA warning, are we supposed to shut it off and say, stop the medication immediately? No, no, no. We're going to do our assessment. What is an assessment for us? It's a collection of data. So what is the right answer? Go back to the research and look at the data. You are going to compare the risk versus benefit, everything that is a risk. There is no medication that is 100% safe for everyone every time. So that is part of your assessment, going back to the research, and you decide based on your capacity, your knowledge, your understanding. That's why you are a master preparer or doctor's prepared, right? Then once we do our assessment, we're going to do our diagnosis, we're going to do outcome identification, plan implementation, and all that is part of the standard of care, right? So, and then finally, we are going to evaluate the outcome and restart the new process. So the standard of care is also many things. Quality of care or quality of practice is part of your standard of care. Education is standard care, to be always reading your research, continuous education, professional practice evaluation, getting along with others, collaborations, right? Ethics, research, and so forth and so on, and leadership, which we already discussed it earlier today. So as you can see, two little topics, it carries so many possible questions, right? So we talked about the scope, we talked about the standard, and all the details that is much more than just reading what the scope is and reading what the standard of care is. So I am going to pause, and then I'll wait for you to read this question and put your best answer on the chat box. Don't look at somebody else's answers, okay? Try to do your best. Okay. Okay. All right, thank you. Thank you for the variation of answers, or mostly variation. Let's start by breaking down the question a little bit by saying we're looking at the standard of care, right? So when we say standard of care, we say ANA, provided by PMHNP. Why? To judge you, right? When we are doing standard of care, what would be the priority to follow, right? The first things we would do. A, holding them to the same standard as a psychiatrist. Oh no, oh no. I mentioned that has to be held to the same standard as another PMHNP. I cannot be held to the standard of a psychiatrist. I'm not saying they're better or worse, neither of those. But I'm not being held to the same standard. I'm not being held by the same standard as a social worker, neither a psychologist or a variation of the above. I'm being held by someone with the same degree and knowledge, not knowledge, but degree that I hold in the same position. So we can cross that out because that is not the standard of care. And that, while it would be nice, that is not it. Let's go to C. The judgment is based solely on, oh no, nothing psychiatry is 100% always, every time. These are too strong of words to say. Solely on patient satisfaction, that's even not necessarily true, right? D, scrutinizing the PMHNP patient charge for inconsistent with past treatments decisions. Well, not really. We're talking about a little bit more of quality of care here, but that is not the priority. So let's see B, comparing their actions against to the prevailing professional practice of competent PMHNP in a similar situation, right? That the similar situation is important because if I am in the middle of a shootout and I am providing care in the environment, is not necessarily what the standard of care would be, but is what the situation that I am involved in right now, right? And what is really important is comparing to the action of another PMHNP, and that is the standard, right? The standard is a book or a authoritative standard or statement that says, hey, this is what the standard looks like. This is what should be followed by everyone else in the same position, right? So hopefully that was helpful, right? So good. Let's take a minute and read this question again. I'll pause and let you answer this question. Okay, perfect. So first, we are looking at the scope, the state's specific scope of practice. Scope is the state Board of Nursing, Nurse Practice Act, right? Where would I go to find out about my state's rules and regulations for my profession? Do I go to the research? Do I go to an online forum? Hey, anyone here is from Florida, and can you tell me about this? This is not necessarily the go-to place you go. Where would I go? I would go to the State Board of Nursing. Which of the following answers kind of describes that? Professional website, a professional association website? No. Do I go to a online forum? No, we don't go to our WhatsApp, even though we do a lot, right? We don't do that. We'll find the scope. Do we go to a national NP certification organization? Do we go to ANA? No, we don't, right? We go to the State Board of Nursing. So which answer is the closest to that? It is C. Okay? Whether we call, whether we go to their website, and we should find all what pertains to what I can and cannot do in my state that I am licensed under. Okay, so tons of questions about scope and standard of care. Hopefully, by understanding globally what it does or what it is and what is not, we can pretty much weed it out almost 100%. So this was just an introduction to the state versus, the State Board of Nursing versus standard of care. So hopefully this was helpful, and we have some clarity on how to answer those questions. So let me stop recording here.